once Mr. Leonard and I laid out the problem and laid out what we suggested by way of a program, he said, let's do it, and let's do it now.
Although the conservative Senate Agriculture Committee refused to report out the WIC measure, Humphrey used his clout to take his amendment directly to the Senate floor. There, Thornton had mounted a dramatic display of photos from St. Jude Hospital showing malnourished children.
And as the debate went on about the bill, Humphrey would take one or two senators at a time and explain to them, here's a picture. This is what we're trying to deal with this program.
You'd think he was a combination pediatrician, nutrition, physician, all combined up there. He was waxing and waning, and he was being listened to, believe me. And of course, it was passed in a very nice, substantial vote.
With the backing of influential Kentucky Congressman Carl Perkins, the House concurred, and the bill was signed into law in September 1972. But then, 9 months passed while the U.S. Department of Agriculture took no action to implement the program.
It was a difficult program for agriculture. They knew how to do stuff with price supports, they knew how to do stuff with the international shipments of grain, they knew how to do stuff with research, but they had never run a food program through public health before, and many of them just didn't want to do it.
So it took at least a couple of years to actually get off the ground, while the Department of Agriculture tried to give it to the Department of Health, Education, and Welfare, tried to whittle it down to a small research project to see if food assistance could change the health status of children, and finally was pressured into beginning the program itself.
To push the agency to implement the program, WIC advocates enlisted Ron Pollock, founder of the Food Research and Action Center, a public interest law firm known as FRAC for short. A few years earlier, as a young civil rights worker, Pollock had witnessed a scene in a Mississippi shack that had fueled his resolve to fight hunger.
Cupboard was bare. The icebox didn't have any food in it. And I saw a young kid with a distended belly. He had all these flies all around him, and he had no energy to swat them away. He had sores all over his body, and I remember leaving the shack and saying, "This is the United States of America. How could this be?"
Pollock was convinced that the WIC program could help prevent situations like this one by filling a gap in the federal nutritional aid effort.
The school lunch program was clearly intended for children in school, so it was for older children. Other programs which started in the early 70s, summer feeding program, the child care feeding program, the school breakfast program, they also were focused more heavily on older children. And so WIC actually had a niche in terms of serving the very youngest children for whom, if they were hungry, it would cause irreparable damage.
FRAC filed suit in federal district court and won a series of victories that forced the agency to begin implementing the program, and the WIC budget ballooned.
So what was originally a $20 million per year program to operate only over 2 years ultimately became a $250 million program, because the remedies we kept on getting in our court proceedings was to spend the amount of money over a shorter period of time. So the annualized rate of expenditure just skyrocketed.
The first WIC clinic opened in Pineville, Kentucky in January 1974. Before long, several hundred clinics were in operation across the country thanks to advocacy organizations which alerted agencies to the existence of the program and helped them apply.
Initially, the Department of Agriculture was not putting together the material that local entities that could apply would need in order to know what the program was about and how to go about applying for it. So advocates put together application packets and then distributed those application packets across the country.
In the meantime, a series of high-profile hearings in the Senate Select Committee on Nutrition and Human Needs, chaired by Senator George McGovern, was setting the stage for the creation of a much larger, permanent WIC program by focusing attention on the toll malnutrition was taking on the nation's children.
We had discovered that low-income, pregnant, and nursing mothers were vulnerable, that at a time when they needed to have a good nutritional balance in their food intakes, many of them were not experiencing adequate, well-balanced diets. And we discovered that children of low-income families were in many cases especially vulnerable to malnutrition.
Among the experts who appeared before the committee was Dr. David Page, who presented the results of the Johns Hopkins Infant Formula Feeding Program.
I felt as though I had a mission, and my mission was to present this information, do it as well as I possibly could, because people depended on me, because this was important for a lot of children, a lot of infants and a lot of families, and they were quite interested, quite receptive, very warm.
So we had a distinguished doctor from one of the world's great universities tell us that what we were proposing was not only possible, but valuable.
With positive results beginning to roll in from the pilot WIC sites, Alan Stone, an aide to Senator McGovern, was tapped to draft legislation to establish a permanent WIC program. As Stone was crafting the bill, he faced his share of skeptics.
You know, when I was first writing this bill, people said to me, you know, public health centers are never going to do this. They don't want to hand out vouchers for food. This isn't what they do. And I said, no, the strength of this is going to be that it is through the health system. It's food and health. And this is the direction the country's going in.
The bill, sponsored by Senator McGovern and Representative Perkins, had strong bipartisan support. It was passed by Congress and signed into law in 1975. The WIC program was to be administered by the U.S. Department of Agriculture's Food and Nutrition Service, but carried out by the states through a network of clinics and agencies at the local level. There, healthcare workers performed health assessments to determine the nutritional risks and needs of participants. Mothers received WIC vouchers, which could be redeemed at grocery stores for foods like cereal, fruit juice, eggs, milk, and infant formula that were high in protein, calcium, iron, and certain vitamins. An important feature of the program was its requirement that mothers receive nutrition education.
You can't just hand out food and think that it's going into the people that it is intended for, and that it becomes a habit, and that they learn to use those foods as part of a well-rounded diet.
By getting people into clinic settings, WIC also indirectly helped participants address their healthcare needs.
WIC benefits does not include health care per se, but because the program is administered by local health agencies, families were then going to health departments or community-based clinics. So in many instances, when families came to WIC agencies, they were enrolled in Medicaid, they learned about immunizations, and there was this wonderful opportunity to provide other services to families, some of whom had never had much to do with community health clinics or local health departments.
While the WIC program was generally well received, one thing that did arouse controversy was its heavy reliance on infant formula.
The use of infant formula got increasingly controversial as time went on, because there were advocacy groups and breastfeeding supporters who felt that if you were giving formula free, it was a disincentive to breastfeed. So the use of formula was criticized, but was very important because the breastfeeding rate was extremely, extremely low.
Over time, as the benefits of breastfeeding became better known, the WIC program stepped up its efforts to encourage mothers to breastfeed.
WIC has, for a long time, provided breastfeeding promotion, encouraging our participants to breastfeed. However, we've gone beyond that now, and we are establishing very strong breastfeeding education and peer counseling that will support the breastfeeding mother.
Today, WIC is viewed as one of the most effective preventive health programs in the nation's history.
We have data that shows that WIC significantly improves pregnancy outcomes. It significantly improves birth outcomes. It significantly improves the quality of health for the infant.
WIC also saves money in the long run.
In other words, the children who are properly nourished and well fed do better in school. They aren't in the emergency rooms with this illness or that as often as others.
If you can make a healthy baby and a healthy mother, you've not only helped their lives immeasurably, you've helped society immeasurably by bringing in healthy citizens.
A large part of the program's success can be traced to the unusual dedication of the WIC staff.
The best public policy and the greatest number of federal resources won't make any difference to any family unless there is dedicated staff locally. And it's the caring and willingness on the part of local staff that you hear time and time again is one of the reasons the program's as successful.
I've had a number of people who say, I like coming to WIC because they care about me. That's been the true success of WIC. The people in WIC truly care.
More than 30 years after its creation, the program continues to enjoy strong bipartisan support. And many people cannot imagine what life was like before WIC.
It has meant a lot to what is now a whole generation of mothers now raising their own infants, and WIC is still there. So from being a very iffy sort of program at the beginning, it has become a basic part of health care, and it is wonderful to see that.
It's one of the best pieces of legislation that Congress has ever passed and has helped millions of young mothers, has helped tens of millions of infants and children.